Nurses went into the profession to work with patients, but they spend a lot of time on charting and other non-clinical tasks. They need help to find charting errors, gaps, and discrepancies to improve patient care and their employers' bottom lines. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz podcast, where I interview top healthcare leaders about their lives and careers. My guest today is Hadassah Backman. She's founder and CEO of GuardDoc Health, which gives nurses peace of mind and provides improved patient care and makes sure providers get paid for their work. Do you like this show? If so, please subscribe and leave a review. Hadassah, welcome to the Health Biz podcast.
Thank you. Thank you so much, David, for having me.
We're going to talk all about what you're doing now with GuardDoc, but I want to start off way back and ask you about your childhood. What was your childhood like? Any childhood influences that have stuck with you throughout your career?
All right. We're going to try to stay away from the childhood trauma because it's not that kind of podcast, right?
Well, it depends, as long as it's, as long as you have a good recovery story, but however you want to spin it.
I think it's all right. So my background is I was born in New York, born and raised New Yorker, like hardcore. At a certain point, my parents moved us to the suburbs outside of New York City to Rockland County. And I always served as the caretaker in my family. Growing up, my father was very, very ill. He had type 1 diabetes that had, at that time, there wasn't as many advances as there are today. So that it manifested in cardiac disease, and he had kidney disease, liver issues, multiple issues. And the role that, middle child sometimes plays to kind of like take care of things and manage things. And I think this was a real precursor for the career that I chose. Also, interestingly enough, my name is it's Hadassah, which is the largest hospital system in Israel, and also it represents it's a biblical name of a woman who was also a caretaker and very involved in making sure that people were safe.
Yeah.
So yeah, it was sort of a preconceived or you wouldn't say Freudian thing that my parents did to me, but I had to go into nursing. I didn't have a choice.
I think that's an understatement of the biblical role, but
yeah. Well, I wasn't going to go into the whole history because I'm not particularly very fluent in it these days. But yeah,
it is very good. Well, it had something to do with Persia, so
yeah, it definitely did.
All right. So, did you know you're going to be a nurse? Or was it, do you think, do you have any independent thought about that? Or that was just the natural thing you already...
I thought I was never going to get married, never have children, and travel around the world and take photos of all the amazing things that I would do. Life did not have that. My first degree was literature and writing. I thought that was something that I could do very mobily. And then I, like everybody else, fell in love, got married, particularly on a young age. And at the same time that I got married and I had two children. My grandmother, who I was very, very close to, was probably the greatest influence of my life. My grandmother was a Holocaust survivor of Auschwitz and Bergen-Belsen. She was actually, interestingly enough about her, she was a political prisoner. Even though she was Jewish, she was considered a political prisoner. So she was there longer than most of your average, but she was a real survivor. And humanity and taking care of other people was a really big focal point for her, and philanthropy as well. And I grew up literally in her home. And then she began to show signs of Alzheimer's and dementia. And this happened at the same time that I had my two children, and I was getting divorced, and I began to become very active in her care, in her day-to-day care. And it sort of gave me throwback to when my father was very ill when I was growing up, and how involved I would be in the care and really be like a patient advocate. And I spent a lot of time in skilled nursing, and that sort of made it very clear to me that this is the pathway that I wanted to go into, that I really wanted to be there for the people who can't speak, particularly for older adults. So I went to nursing school, and my grandmother passed away while I was in nursing school, actually. And right out of nursing school, I was very, very lucky to receive opportunity to go straight to Northwell. It doesn't happen for new nurses, particularly at that time. It was, it's interesting because that was a time that the market was saturated with nurses. We weren't getting great jobs, but I was particularly lucky, and there was a residency that I wanted from emergency medicine, and I went to Northwell Forest Hills. I worked there, And I did emergency, I did medical surgical. As at that point, I was a single mother, so whatever shift I could pick up, I would take. But also, because of my nature, I didn't want to just know how to do things. I wanted to do them well. So I'd get, certification or training associated with that type of unit that I was servicing. Like if I was going to, post-op, I would want to know how to be a really good nurse post-op. Same thing with telemetry, being able to read monitors well and be able to detect when there's any kind of anomalies. But it was really my moment that I think changed me as a nurse was in the emergency room. I was working in the ER, and I had a patient that came in, and it was, we had just migrated from paper. I'm not that old, but we migrated from paper to, at the time it was called Sunrise, but then it became Allscript. I have no idea who owns it now. It was pretty much dominating the industry as an electronic healthcare record, but now I think we've moved on to Epic and Cerner. But at this time, the communication between the nurses was very, very poor because everybody was getting their bearings on how to use the electronic healthcare record. And in general, it's emergency room. It's a crazy environment. I had a patient who was who came in who had showed signs of sepsis, and I hung Zocin. I'll never forget it, the antibiotic for the patient. And then when I went back to the chart to double check, I realized that the nurse had documented in one place that like in a previous admission, because I was so careful, in a previous admission that the patient was allergic to antibiotics, to this type of antibiotic, but it wasn't documented in my chart. Right away clamped the antibiotic, used saline to flush out the veins, told my managers to Sentinel event. Patient was fine, but the thing that really hit me, and I think stayed with me my entire career, is that we'll go back to my being 15 years old, being the little caretaker that I was of my dad. And my dad had been given penicillin when he was allergic to it for the same reason, that the information was housed in one area and it wasn't communicated in the other area for the nurse. And this fragment in the communication impacted the nurse to give him penicillin, but his reaction was much more dire because they caught it later on, and this basically accelerated his end of life. So here I am years later thinking I'm a super nurse, and I'm making the same exact mistake that happened I think at that point it was 15 years earlier. And it really struck me on how fragile the system is and how much it relies on us to get things right. And so that could create anxiety in a nurse because you want to do the right thing and you realize that so much is on your shoulders. For me, I really do believe that it helped me check my work a little bit more carefully and ask questions and also not try to override things. But, we do that sometimes when pop-ups come our way, we override. But to make a long story short, shortly after I had taken a certification in hospice and palliative, and because I always loved older adults, I knew that was my calling, and I fell madly in love with it. I built up a hospice and palliative program for MJHS and New York City, primarily at Memorial Sloan Kettering, and then I went on to manage the New York City, Bronx, Westchester teams. Really, really loved it. I have to say that this is where my understanding of healthcare as a business and the clinical aspect and then the financial aspect really became very clear, because hospice even though MJHS is non-for-profit, hospice has a very specific function in terms of controlling the costs for patient care, and you really need to fit all of the care that you need to provide for a person who's really critically ill into a capitated rate. And understanding how to do that and how to utilize your care sources and how to sometimes do insurance carve-outs became my thing. Like I really liked it. And I really actually got excited when we could do things that nobody thought was possible for the patient. And I think that, when I look back at my career, this was probably the greatest turning point. And also just the kind of care that we provided at MJHS. We had a special Holocaust survivors program, which went into a PTSD program for veterans of Vietnam and some other wars. 9/11, we had worked with a lot of people who had lung cancer or different mesothelioma from post 9/11. So I think that was a major turning point to understanding how to really optimize care for my patient within the structure of regulation, because regulation is very structured. And everyone's afraid of regulation. Everyone's afraid of compliance. It's like the big bad wolf, like CMS is coming to watch you. But if you really think about what's at the core, it's essentially there to protect the reimbursement models, but also what you're being asked to comply with is really to ensure patient care. What's the problem? What's the barrier? The barrier is that the amount of the amount of information that's required to ensure that you're meeting compliance is daunting for a nurse. It's actually debilitating because you have this balance of providing patient care, good patient care where you're making eye contact with your patient, you're actually delivering the kind of care that you went to nursing school for, with trying to meet compliance, which has a number of data points that you need to accumulate as a nurse. I always say, nurses, you're not a nurse, you're an investigative reporter. Because the way our healthcare system operates is that our electronic healthcare record for our doctor's office is rarely, unless you're in a healthcare system that all uses Epic, is rarely the same system that your home care uses, that your hospice uses, that your skilled nursing uses, that the hospital uses. So you have all these fragmented systems and they're not speaking to one another. And all this really important information is either dependent on the patient. When you're in stress, do you really remember exactly what medications you're on when you're taking it, what's going on? You're in stress. Or on the nurse to really gather that information and what's happening to nursing. Nurses, my time, like I said, it was difficult to get a hospital job, and now we're in a crisis. There are just not enough nurses. So this became more and more of an awareness to me, but I wasn't thinking I'm going to solve the problem. It wasn't something
right.
that
It sounds like you were, so it sounds like, like very smooth narrative up here. You figure out what you were doing and you're living your life and boom, put it together. But then it seems like you made a dramatic change. Maybe it all flows together, but like, why are you going to have your own company too?
Well, I'll tell you what happened. It really started with pre-COVID. At 5 years of hospice, I always promised myself when all my patients converged into one person, like I didn't have the empathy because I had lost two people that I was very close to. Mm-hmm. And there's a difference between empathy and sympathy, and it's a conversation for a different time. But without empathy, you cannot deliver that level of care. And I was starting to get burnt out. So I felt that I spoke to my directors, my VP, Susan Leach, one of the most amazing women I know, my VP over at MJHS, and I said, I don't think I should continue down this road anymore because I'm not the same person that I was. And I decided to take some time off, and then I'm like, oh man, what am I going to do for a living? Now I can always go back to the bedside. I could go to the ER. I had a certificate for telemetry. I could have done a lot of things, but I decided to open up a consulting company.
Yeah.
Really focused on compliance again. I would joke around with my sisters and they would tell me, it was so cool to say our sister's an ER nurse, but now what do you really do?
Yeah.
What do you do for a living? But I felt that compliance is the area that everybody's afraid of, but it's essential and existential to an organization. Yeah. You must meet your regulatory compliance in order to get paid, in order to be able to function. And to have any kind of financial standing and also actual being able to deliver care. So my consulting company's focus was started off as me as a principal, but then I'd hire other nurses to work with me, was clinical compliance. And I went on to focus on legal nursing, risk mitigation, quality assurance. And that was my focus, and I loved it. I really, really loved my life. I would go into organizations and I would talk to them about find out what their pain points were. I'd do excessive amounts of chart audits, forecast trends, look at loss runs when I was working with insurers. I worked with Hub International as a brokerage doing risk management. And I built up multiple programs, training, but a lot of it always bothered me. There was always something in my stomach that bothered me, that we were really just cleaning up the mess after the fact, that there's nothing really mitigating the core problem. The core problem is that we have tired, burnt out healthcare professionals who are tasked to establish a patient baseline with minimal information. That's the core of the issue.
Got it. So you're auditing a chart that can't really be perfect because of all the circumstances surrounding the inputs that are put into it.
Correct. And it's really after the fact. So it's very nice for me to come in 3 months, a year later, and tell you how to lessen your risk in terms of litigation, in terms of CMS compliance. But what am I actually doing for the patient? Maybe they died. Maybe they left the facility. I'm actually doing nothing. I'm just lessening the pain, but I'm not really, it's clean. I joke around with I have a 17 and 18-year-old now. And I joke around with them. I was just out of town for business, and I come home, and my apartment's a wreck. And I asked my daughter, like, what happened? She's like, I cleared up. What do you mean? I was like, you cleared up, but you didn't clean up. Those
Yeah.
are two very different things. Clearing up is just sweeping things under the table. Cleaning up is getting to the root cause of something and making sure that it's, that you've uncovered whatever dirt might be there.
And I bet she said, "Thanks, Mom. That's clear now. I'll take care of it from now on."
So she said, "What do you mean? Oh my God!"
Yeah, yeah.
And I didn't have anybody over. I'm like, I saw it on the camera you did, but whatever.
That's all right. So okay, so why did that? So consulting was a company, but you knew you had to do something different. But how do you know what to do?
So we'll go back to the year. So the year that I really, my consulting took off. I think I had to hire another nurse to work with me because I had a lot of work contracted with Hub International, with other clients that they have a large book of business for nursing homes. And I was really that busy with skilled nursing. And I started to fly around the country. Then COVID comes. COVID-19 came to New York City. Now, if you know my nature by now, I'm not the type of person who's going to stay home and watch Tiger King. I couldn't do it. I decided to talk to my children and say, Mommy is going to go to the fields. You're going to go stay by your dad's for like a couple weeks, maybe even a month. And I'm going to work, go again to the bedside. And I took a leave of absence from my consulting company. All of my clients were amazing about it. And I went to work at the bedside again as a nurse. And I floated. I'm a floater, and I'm very comfortable floating. So I floated to multiple types of facilities, and it really bothered me. I found my documentation as somebody who came in and cleaned up the documentation and made things better and gave the educations and training and boot camps on how to better document. My documentation was garbage. And the reason it was garbage was because I couldn't compile the information fast enough. And some of the things that I saw in facilities happen to patients could have been really avoided by better communication. Because if you think about what clinical documentation is, it's really not to punish the nurse and add work to the nurse or the doctor. It's the vehicle of communication from one provider to the other. And without concise, and non-subjective documentation, you're flying blind. And that's really what went on during the heavy days of COVID, which is obviously an exacerbated situation. But that's when I really had enough. I was like, this just doesn't make sense. This industry is not going to be able to continue unless there's a more proactive approach. So I finished my 2 months working, floating around a couple different facilities, and I started to research: is there a technology out there that mitigates issues in real time? Because again, at this point, it's the end of 2020. There's got to be. We have AI already. We know that this is an issue. It's not, I think, an issue in the industry, and there wasn't. There are multiple consulting companies, good ones too. Nothing. I wouldn't, negate the great work that they do. That do high-level audits, that assist facilities with manual audits using Excel spreadsheets or some jerry-rigged system. I went to my sister. My youngest sister is a nurse. She's also a former ER nurse, and she does informatics over at the Westchester Medical Group Center, all their hospitals, and she does primarily she implements softwares. And I go to her and I say, Rachel, what do you do to capture errors in real time? She's like, oh, there isn't anything. She's like, what we do is we use this system that scrubs things, but you're really hoping that the nurses or the doctors are getting their information correct from day one. Yeah. And you have no previous information that's usable anyways. It's coming in a PDF or somebody's crumpled piece of paper when they show up into your facility. So that's when I felt like something needs to happen if no one else is going to do it. I've never lived my life in a very conservative way, so I'm going to.
So you would do it. And so now, how did you actually then go, though, because your background isn't necessarily in software or AI, even though it was around, and it seems in some ways most people would say, they spend hundreds of millions on an EHR, shouldn't that be able to do it? You don't need another solution. So how did you then actually insert a piece of technology that would do the job?
So I wanted to see if my hypothesis was correct, right? So at the end of the day, I love science. I like science better. That everyone jokes around about it, but I'm like very factual. And I have a kid who's like all hippie and wants to talk about feelings. And I'm like, yeah, but what's the fact? This is how you do, this is my nature. So I had a theory. That we could reduce losses and we can improve reimbursement for organizations if there was that catcher's mitt. Think about baseball, right? A fly ball comes out your way. It could be a home run for the other team, or you can catch it midair. So if you had some kind of catcher's mitt in place. But I need to prove it now. So through my own consulting company, I went to several clients in the long-term care space specifically, because long-term care is my field that I'm very, very comfortable with, but also you have a lot of knowns in long-term care. You know how to treat, what treatments are, what nursing care plans should be in long-term care, and it's pretty much a formula throughout the long-term care space. So I decided to launch a manual, 100% manual program, and it was the most insane thing that I've ever done. But I found a group of nurses who were living in Israel. That's the connection with Israel. They were all Americans. They had moved to Israel as part of like that immigration that people do. And they had come out here, but they couldn't work because of COVID. They couldn't transfer their licenses. So they all were unemployed. So I set up a network. I created Excel spreadsheets with what a CMS auditor or a legal nurse would be looking for in a chart. And I approached several clients in the long-term care space, and I said, you had a very bad survey last year. I'm going to turn it around for the next year. But here's how we're going to do it. Every single time your nurse will see a patient in the U.S., on the back end, my guardian nurse, we call them guardians, my guardian nurse will audit the chart in real time, like within 24 hours to 48 hours, in the critical time frame that you can actually make changes. They will push back a plan of corrections, and your nurse in America is going to have to make the corrections, and we're going to double check that the corrections were done. And my clients like really had faith in me. They believed in it. So they allowed me to pilot it. It was a paid pilot. I always have to say that because I think it's really important to have an idea, but it had to also to prove that people think it's valuable enough to put their wallet into it. And we had incredible results. Within 6 months, first of all, we reduced the errors the nurses were making, because it's like working out. The more they would see the same error, they'd be like, okay, I'm going to work out that muscle. I keep making a mistake on medication orders. I know that medication orders is my weak spot. Now I'm going to try to be more cognizant of the errors that I'd be making. The same hand, we were aggregating information from multiple sources for them, so it was all pulled together, so they'd have a better patient profile, particularly for repeat assessments, which was really helpful. And we reduced errors by 50%. We also were able to show, and I say we because it really wasn't just me, it was these amazing group of nurses that I had working for me. I wouldn't have been able to do it. I could be the mastermind behind it, but they were doing the day-to-day auditing and also doing it in a way that wasn't off-putting or felt like, big brother's watching you, to the actual nurses who were delivering care. So we were able to have really good communication between both groups. And then we had repeat surveys for 2 customers. One had 0 citation, 0. Mm-hmm. They actually hung that up on their wall. The other one had a citation related to nutrition, which had nothing to do with us. We couldn't help it. The food was bad. But, but we really accomplished what we needed to. And I built that up to 4,000 patients, 9 paying customers. And then I hit a plateau. Yeah. It's now, to me, it's not manual anymore. It needs to be turned into a software. Yep. So when I need to do something that's radical, I go to another sister.
Yeah. How many sisters do you have?
I'm one of 4 girls. I'm smack in the middle. And then we have a baby brother.
Nice.
And we're all very, very close. And so my oldest sister was working with the finance ministry in the state of Israel. And I had known, some tech leaders through her. I had met them, when she was doing different initiatives. And I knew that the technology here is unparalleled in terms of the agility and the ability to move very fast, particularly because of many of the people who go into high tech are coming from one of the elite units that are really savvy in terms of technology. And I had asked her to connect me. And then I started the journey into, software entrepreneurship. A lot of mistakes along the way. Yep. I would tell anybody in my, to ask people who know better than you and don't assume that you know anything, because it's a completely different industry. I was sent to the A200, to something called Team 8. I sent around from place to place to place. It led me up to, meeting somebody that I can develop the software with, getting accepted into the MASH challenge as a finalist, getting invested in first in a pre-seed round where I raised up $885,000 from Europe, from America and Israel. And then for our most recent round, which was a seed round led by Tango Ventures, which is Israel's #1 venture capital. And then followed by Bertelsmann, which is Europe's European PE. They're amazing, and American as well. Springbank, and fresh funds. So we had a very, very strong group of investors who believe in this.
And how did you find, because I don't know if you had the background with, it sounds like nursing background, software, not necessarily found your way into that. How about finance? Was it also, you knew
It
about
was
investors already, or how did you figure your way into there?
I didn't know, but I knew I needed to get invested in. In the early days, I bootstrapped because I had made some profit on that pilot.
Yeah.
I had money to invest in, and I am the first investor in GuardDoc, and I was
Yeah.
and I believe so strongly that I moved both my children and myself to Tel Aviv in February 23 to sit with product and tech because I believe so strongly in what we're doing. I knew how important it is, and my conviction really led me. But I didn't know much about fundraising. I had to learn on the job. You need funds. At the end of the day, you need significant funds to build a technology, to build a tech team that's dedicated and really is going to, build it the right way. Where I always tell everybody, like, we're in compliance and regulation, we don't have margin for failure. We can't do the test on people. We just can't. So we have to do all of that before we go out. So fundraising was a learn on the job experience for me. I got introductions and I took negative feedback that I got from people and turned that into positive feedback that I had, and I think that the real turning point was even prior to my pre-seed round. I met with Jonathan Glazer, who's an investor at Tango and is my investor and co-board member today. He's an ER doctor, and he understood right away what I was pitching. And he rallied for me every step of the way because he saw the value and he also understood that the problem that we're addressing is a global one. While we're primarily focusing on US right now, it's a very defined payer source. It's a very clear market. The regulation and compliance is very, very clear. And it's like 80% the same of what you're looking for and 20% outlier. So it is different than anywhere else, but he understood this as a global issue, that we put this onus of investigative reporting on a overburdened staff that we're having a major shortage in. So he wanted to be involved, and he was probably one of the greatest champions, along with Odette Burrell from Fresh Fund, which was like one of our first VCs, and Alana Berkowitz from Spring Bank. She worked for the Obama administration, brilliant woman. She just really, really rallied for this to
Nice.
to be funded.
So you got the funding, you got the customers, you're moving forward. Where do you see things in 5 years or so?
Well, my goal is to be the gold standard for CMS. I can't promise that's going to happen in 5 years, but for CMS compliance. But our goal is to we will never replace nurses. And I want to be very clear. We use technology today and AI, but on the back end, our quality assurance is done by nurses. And one of my customers recently asked me why, because I said how much I believe in technology. I still believe in nursing, the critical thinking that comes along with it, and that holistic view of a patient that I don't believe that technology will ever replace. To quote an author I love, Yuval Noah Harari, he says doctors might be replaced faster than nurses, and I believe in that because of that holistic view.
Interesting. So, what would you say is the biggest challenge, or the big challenges that you look at for making this vision successful for the company?
It's utilization. I think that I think back to the young nurse that single mother wanted to go home to both her kids, that was told that we were migrating from paper, which was so much easier, to a software. I think we're now going to see a lot more tech savvier nurses, but my age is somewhere hovering between a millennial and Gen X. It depends on who you ask.
Yeah.
And we weren't comfortable with technology. My first cell phone, I had to sit there, when you send a text message and sit there pressing the button.
Yeah. I remember that.
Yeah. So we weren't comfortable with technology. And every single hour I would spend on documentation after work would cost me money with the babysitter. So I need to go home. And I was overwhelmed by the amount. And I remember joking around with my friends at work, saying, whoever created this technology never spent a day on the unit. They have no idea. They have no idea what our lives are like. Those pop-up alerts, and then they give you the access to X out of them. So it doesn't really do much of anything. You can override the system. They didn't design it understanding what these workflows are, what you're up against when you're on your feet for 12 hours, and how to simplify it in a way that it's not imposing on the end user. And so that to me was the biggest challenge, is that how do I create a software that people love, that people want to use, that people believe in is going to make their lives easier, not make their lives harder? And how do I really live to that? And so that was to me the challenge, because if we think back to my manual program, it was imposing. They just liked it because it really saved them time at the end of they saw the value when it came to somebody chasing them with a PDF report. So we got buy-in. It was small scale, but if I'm going to do this on a large scale, okay, across the United States, thinking of we're in rural nursing homes.
Yeah.
One all the way in a place called Wabasca, Minnesota.
Nice.
Yeah, I love it, actually. I love going out there, and those nurses to me are heroes. And then we're in Newark, New Jersey. So we run the gamut in terms of the type of user. So how do I create it in a way that a nurse who has no time and a nurse who knows the patient because she grew up with them in the same town, how do I make it appealing to both of them? And that's always been the challenge. We're very, very product driven and very customer driven. Initially, when we were in the Mass Challenge, we did a canvas of nurses. We took rural, we took urban, we took travelers, and we asked them questions, and we had them beta test with us. And then with each launch that we do, we hold hands with them. It's a nurse that is your customer success person. It's a nurse that's your quality assurance person. So there's somebody who on the other end who knows the language that you're speaking. It's a nursing heavy company. We continue to hire nurses in these roles. Technology is built by the experts in tech. Anything I dream, they can build. That's really nice. But at the end of the day, how we design the product is based on what the nurses want to see and how they want to use it. And when they're having difficulty with something, we listen to them and we make the adjustments.
Great. Well, Hadassah, the last question I have for you is about reading and books. You already alluded to an author, but we'll see. Have any chance to do any reading either lately or in the past, and anything that you would recommend to our audience?
To entrepreneurs or for my own self?
Well, anything you've read that you liked for whatever reason, that's just good for for any listener.
It's a bad word, but Everything is Effed by Mark Manson, a story of hope, because it's about proportion and understanding, and and having a bigger vision. And I think that drives me. Today I have 20 employees from very different walks of life. I have American, I have Israeli, I have Jewish, I have Muslim, I have Christian. I very different walks of life, and understanding them and seeing how each division and each unit operates from a bigger view has really helped me, and not focusing on the minutia, but really focusing on what our bigger picture is. We're here to innovate the nursing experience, to take that heavy duty compliance manual processes that weighs them down so they can make eye contact with their patients again. We became nurses because I'm that little girl who sat there giving my father his insulin shots and taking care of my grandmother. I'm that little girl who at the end of the day, wants to see impact and wants to make people feel better. And I believe that is every single nurse I come in contact with. When I lecture, whenever I meet with nurses, I always ask them to write down on a piece of paper why they became a nurse. And nobody ever says to document, by the way.
Yeah.
To date, nobody said to document. And we want to tap into that. And as a leader, I think it's really important to see what drives all the people who are behind the scenes, like behind the Wizard of Oz curtain, all the people who are making this amazing software that is really helping the nurses in the field. What drives them to get up in the morning and build the technology, to automate, to write code, to work on the product, to the nurses who do quality assurance, to be on those calls at on different time zones, to walk a nurse through any difficulty that she's having. What drives them, and to be able to hone in on that. So I do think that's a great book. I love Mark Manson, and want to be able to read more, but time has been a little bit scarce.
Fair enough. Well, Hadassah Backman, founder and CEO of GuardDoc Health, thank you for joining me today on the Health Biz Podcast.
Thank you so much for your time. I appreciate it.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.